Alrighty, here we go. Hello, and thank you for watching this program on how to create a Medicare policy and procedure manual. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. Target coding is not a law firm. We don't provide legal services. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. A little bit about myself before we get going. My name is Dr. Marty Kotler. I am a chiropractor. I practiced for 16 years. And then about 12 years ago, I started a company called Target Coding. I'm certified in CPT coding. I'm a certified professional compliance officer. We've been helping thousands of chiropractors across the country over the last 12 years with billing and coding, documentation, compliance. I've written many books on billing, coding, and documentation and training manuals. I write articles for Chiropractic Economics and Dynamic Chiropractic, and for many other magazines relating to chiropractic. And I'm also a guest speaker at many state association conventions nationwide. So let me ask you a question. Let's get started here with a question. Why is a Medicare policy and procedure manual so important? It's also known as an OIG compliance manual. You may have heard of that OIG. So let me tell you why it's so important. But first of all, let me explain the OIG, which stands for Office of Inspector General. They have a mission. Their mission is to protect federally funded programs like Medicare, Medicaid, TRICARE. Any federally funded program, the OIG is there to protect it from the bad people out there that are committing crimes, fraud, abuse, and taking advantage of the system. So the OIG needs to protect these services that are provided to millions of patients nationwide. So chiropractic is a covered service in the Medicare program. So that's why the OIG looks at chiropractic and does data analysis on chiropractic. And over the last, 10 years or so, they've done reports on chiropractic, 9 reports actually. And they basically are telling us that we need to do better. Many of these reports are, some of them are directed towards specific chiropractic offices, and some are just general reports on how we're doing based on the data that they've collected. And there have been many of them. This one here from October of 2016 revealed a lot of information. Revealed that hundreds of millions of dollars was paid to chiropractors that did not meet Medicare requirements. This is the most recent one from August of 2017. A Brooklyn chiropractor received a few $100,000 in Medicare payments. So there have been these reports and analysis, and the OIG report from August of 2016 revealed that they're going to be taking some action steps, and they're going to be increasing audits on chiropractic services based on these reviews and based on this is the OIG work plan. Every year the Office of Inspector General puts out a work plan, and anyone that's listed in the work plan, they're basically saying you're on notice where we're going to be looking at things you're doing. And there's many different healthcare professions in here. We're not the only ones. Physical therapists are in here quite often, DME suppliers, hospital services, nursing homes, home health services, medical equipment supplies. So we unfortunately are in this report in 2017. Here's one here from physical therapy. So Medicare wants you to be proactive, especially when it comes to proper billing and coding. So this includes, so how can you be proactive? Having staff trainings. Now you might say, yeah, we have staff trainings. Well, do you write it down? Do you make it formal? When I say formal, we're talking about having a staff meeting and documenting the topic, who attended the meeting in a training log. So that's one of the things that Medicare wants you to do. They want you to be proactive. So again, Why is a Medicare policy and procedure manual so important, and why do you need one? Well, it's required if you treat Medicare, Medicaid, TRICARE, or any other patients that are receiving um, um, federally funded services. So if you see Medicare patients, it's a very good idea to have a basic Medicare billing and coding procedure manual. So what what you can do is, even if you aren't seeing Medicare patients, many of you on the listening to this presentation, you might not see Medicare patients. Well, you should still have a basic billing and coding policy and procedure manual. And what it does is it can prevent billing and coding errors. See, Medicare can deny services as not being medically necessary. That's one of the things those reports found, that chiropractors were billing for services that the chiropractors were billing it as active treatment, but the documentation made it look like wellness care or maintenance care. So Medicare will deny services that are considered maintenance care as not being medically necessary. And if you got paid for it, see, this is where the problem occurs. Getting paid for services that are not medically necessary can be construed as you're billing fraudulently. So billing for services that you are billing it as with the AET modifier as active treatment, and then you're audited, and then Medicare says, this looks like it's wellness care, maintenance care. The patient is coming in once every couple of weeks. They're coming in, your notes look like the patient is just coming in for a little tune-up, a little oil change, and the patient's been getting one adjustment every 3 weeks for the past couple of years. Active treatment doesn't look like it exists. Doesn't look like there's a beginning, a middle, and an end. Well, we consider that care not medically necessary. Now, again, if you're getting paid for those services that are considered not medically necessary, that could be considered fraud and or abuse. So, if you're questioned, you see, because of the increased audits that are occurring with Medicare, you might get questioned, and you might get asked, do you make any attempts to prevent billing and coding errors? That might come up in a conversation with an auditor or an investigator, and not necessarily only with Medicare. As I mentioned, it's a good idea to have a general billing and coding policy and procedure manual, just in case you get questioned by an insurance company, or a staff member becomes disgruntled and accuses you and your practice of billing incorrectly. Well, if you have a policy and procedure manual, that's what it is. What's in writing, that's what counts. You could have a staff member quit on you and say, I think this practice is, billing, Aetna and Cigna incorrectly. It actually just happened to one of the doctors that I work with in Georgia. One of her associate doctors just one day said, I quit. I don't think you're billing and coding properly for time-based codes. And this is to personal injury carriers. And this associate doctor just stormed out and said, I'm going to be reporting you to all of the insurance companies because I don't think you're billing and coding properly. Well, this practice has a billing and coding policy and procedure manual, and that's what everybody abides by. That's what everybody signs off, that they abide by it. So although this staff member was very upset and just stormed out, there's really nothing that nothing's going to happen, because everything is documented, everything is being done properly. That's this associate doctor's, these accusations really aren't going to get too far. So if you were ever questioned, how do you, prove that you're making formal efforts to prevent billing and coding errors? Well, a billing and coding procedure manual can provide the proof. Now, when it comes to Medicare compliance, it should be based on the Medicare suggestions on putting together a compliance program. Specifically, the OIG put out a recommendation checklist. It's called the Compliance Program Guidance for Individual and Small Group Physician Practices. If anybody would like a copy of that, just let me know. But I'm going to be giving you the main points of it right now, like right here. These 7 essentials are the key to creating a Medicare policy and procedure manual. You need to have written policies and procedures. You have to conduct regular staff trainings. You must give the impression that you have open lines of communication. You need to name somebody as the main compliance officer. You don't like that term, office manager, billing manager, billing and coding supervisor. Somebody needs to be named that person. And if the doctor doesn't feel comfortable naming a staff member, then the doctor could name him or herself the manager. You need to conduct internal reviews. I'll show you how to do that in a couple of minutes. Respond promptly to detected offenses and take the appropriate corrective action plan, and enforce proper disciplinary practices. So these are the 7 essentials. This is what you should be doing in order to create a policy and procedure manual on billing and coding. You should follow these 7 steps, and I'm going to give you examples coming up. Now, there are certain things that can trigger an audit, and then you may have to produce a compliance manual. So Medicare, in certain parts of the country, Medicare has teamed up with a company called Strategic Health Solutions, and they're doing audits. Certain states, they're really going after pretty deeply. So they're sending letters to many chiropractors across the country, and I've had the opportunity to review these audit letters. I've had the opportunity to speak to many of these doctors. I've assisted many of these doctors with these audits. And fortunately, they're all going very well. Most of them are turning into no refunds at all. But these audits that are occurring right now with this partner that Medicare has called Strategic Health Solutions, they're saying that the audit is relating to the 2015 OIG report that said $76 million for chiropractic services were questionable. And there have been other OIG reports, as I mentioned. So these are the questions that always come up. And it doesn't always have to be a Medicare audit. It could be just a general audit. Blue Cross Blue Shield, Aetna, Cigna, Optum, United Healthcare says, we want to see your notes. Do you have to send in the information? Yes, you must submit the requested information. If you don't submit the information, it's going to be interpreted as a 100% error rate, and then recoupment process will probably start. Another common question, can I charge Medicare for making copies of the records? No, Medicare states that they are not authorized to reimburse providers for the cost of copying the records. Some of the doctors have been sending in, 500, 600, 700 pages of information because of the amount of records they were requesting. Next, submit records for all the dates of service on the claim. So you want to take a look at the claim that was submitted with the date of service requested. Is there more than one date on the claim? If yes, you may have to submit the notes for all the dates of service on the claim, even though they were only asking for one. Each set of patient notes should be evaluated on a case-by-case basis to determine what information should be submitted, and that's something that we could do if you wanted us to take a look at your notes and do a quick chart review. We offer that as a service. Provide any exams, re-exams that could help support the medical necessity. Like many doctors, when they're asked for notes, they wish they can go back and change the notes, which you can't do, but you could supply something called the treatment summary, which I'll share with you in a minute. But many doctors say, man, if I can, reverse the clock, I would have added more re-exams, I would have updated my goals. So start doing that now, moving forward. And the treatment plan is part of the overall plan of care. So the treatment plan should include the chief complaint, the part exam, the primary diagnosis, which for Medicare needs to be subluxation, the goals. The goals need to be measured at the beginning of care and then remeasured with every re-exam. Those objective measures to evaluate the effectiveness is what Medicare wants to see. And again, back to regular insurance, Aetna, Cigna, Blue Cross Blue Shield, they want to see how the patient is improving. They want to see substantial improvement, especially after a couple of weeks. And They also want to see a beginning, a middle, and an end. So you want to ensure that the record submitted gives the impression it's active treatment. Active treatment is a Medicare term, so the chiropractic guidelines on Medicare talk about the difference between active treatment and wellness care. So when submitting claims for reimbursement from Medicare, you have to use the AT modifier, which means active treatment. If you don't use the AT modifier, the claim is automatically going to get rejected. Now, here's another question that comes up. Can I make changes to my notes once they've been entered into the record? No, but you could put together a treatment summary. If anybody's interested in getting a treatment summary, just send an email to natasha@targetcoding.com and she'll send you that sample. This will help explain your treatment approach. It'll clarify any vagueness and point out the most important parts of your documentation to help support the medical necessity. It's dated today. Even though the services may have been rendered a year or 2 or 3 years ago, the treatment summary is dated today and you describe what's going on. And it's a very good thing to do. If your notes don't look great, it's a good idea to put together a treatment summary as a little cover page explaining your overall approach to care. So Medicare requires a policy and procedure manual. Now, as I mentioned, even if you don't see Medicare patients, the general billing and coding compliance manual is a very good idea to have. We recommend it to all of our clients. But let me give you a couple of sample Medicare policies and procedures. Our Medicare policy and procedure manual at the present time has 18 policies and procedures. We may be adding a few more soon, but right now we've started off with 18. And some of these may sound very straightforward. And you may be saying, well, why haven't I been doing that already? So here's Policy 1.2. Medicare requires that you do internal reviews. They want you to take out a couple of charts every, 3, 4, 5 months. What I recommend is 3 to 5 charts every 4 to 6 months. Take them, open them up, look at them, and evaluate them. Now, you might not know how to evaluate them, so what we've done is we've put together a checklist. It's an Excel spreadsheet. So, is the patient's name and date on the note? Yes or no? Have you listed the primary diagnosis codes of subluxation? Yes or no? Are the ICD-10 codes put in? Have you done a proper exam using the PART method for Medicare? Have you listed the short-term goals and long-term goals? What modalities are going to be recommended? On a typical SOAP note, did you designate the areas of tenderness, misalignment? Are you using the proper modifiers? If the patient is up to wellness care, has the ABN form been signed? So this is a nice little, I call it a little audit tool checklist. Another thing that Medicare requires that you do, again, this is a Medicare thing. If you don't see Medicare patients, I recommend you just have a generic billing and coding manual. So if you don't see Medicare patients, you don't have to go to the Oig Exclusion List. But I'm assuming most of you listening to this presentation, because of the name of the topic, you are seeing Medicare patients. And although, a lot of chiropractors complain about Medicare, most chiropractors do see Medicare patients. That's just the reality. So one of the things you need to do if you see Medicare patients is go to the Oig Exclusion List website and put in your name and see if your name pops up. Hopefully it doesn't. If your name pops up, then you are not allowed to treat Medicare patients. You don't want your name on the list. So this is an example of what the results. So what we train our clients to do is go to this website, put in your name. It's going to say no results found. That's what you want. And you want to print out that page and put it in your policy and procedure manual or scan it in and put it in a digital file in your computer system. What we do with our clients, some of our clients say, Marty, I want a policy and procedure manual, but we're going paperless. Great. We email the entire policy in digital files, and we have some clients that go, Marty, I still want a paper manual. I want a 3-ring binder. I want to be able to look at it and touch it. So we offer a 3-ring hard copy binder. So what we do now is we give all of our clients both, and you could decide whether you want digital or hard copy. So you'd need to print this out, and you should do this for every single person that works in your office. This isn't just for the providers, because what Medicare sees in many of these scams and many of the criminal activity that occurs is it's not only the doctors involved, it's office managers and staff that are part of the scheme. So their names are also listed in this database. And the other thing that is very important as part of a compliance manual is going through areas of risks and areas that you focus on. For example, if you have an open adjusting room, you want to have a policy on it. So, it says something like here, we utilize an open adjusting therapy room. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room if requested. That is given to the patient. They sign off on that policy. The internal staff members, everybody knows about that policy. And there you go. It's etched in stone. And now nobody could really argue with you on that. A patient can't say, they never told me they have a private room. Wait a second, Mrs. Jones, you saw our policy, you signed it, our staff knows about it, they explained it to you. Another one that's, I think, very good is many chiropractors will adjust a patient full spine. In my practice, if a patient came in with neck pain, I still check the mid-back, I still check the lower back, and I would adjust a patient's lower back even though they had no symptoms at all. So how do you bill for that? It's an important part of a practice. You don't want to give the impression you're giving away free care. You don't want to bill for services that are not medically necessary. So there's a little bit of a gray area with that. So you want to get rid of the gray, make it black and white by stating, with every patient encounter, we analyze the entire spine. Very important for activator practitioners. We analyze the entire spine. That's what we do. During most patient encounters, we perform chiropractic adjustments on medically necessary regions, as well as on regions for supportive maintenance care or for compensatory compensations, that occur, secondary compensations. And our policy is to only bill for covered services, medically necessary services. If you offer, cash discount plans, if you're part of a DMPO like Chiro Health USA, it's a good idea to put it in your policy and procedure manual. This is something, regardless of whether you see Medicare patients or not, every staff member should just get a quick update on what is anti-kickback and what is Stark law. So these are just all of our examples of our policies and procedures. Here's a sample employee training log. You do a training. This one, Debbie here is our sample compliance officer or office manager, and she held a meeting on January 15th with Ann and Beth and Carrie and spoke about deductibles and coinsurance. Just enter it in your training log. It makes it formal. I will create policies and procedures for those of you that are interested in having one of these created for your practice. I had a client say, Marty, I need a policy and procedure on cell phone. My staff, I walk by the front desk and they're on their phones and they're texting their friends and they're doing personal stuff. I need a policy on cell phone use. So I put together one. So if you have a specific situation in your practice, share it with us and we'll put one together. I have one here that I created for my clients that see Medicare patients. Just a simple policy on your ABN. When do you fill out ABN forms? What's your policy on ABN forms? Staff reads it, they sign off on it, and now you've decreased your exposure if there's ever a problem. So let me just ask you a couple of questions here just to test your knowledge. Can you treat Medicare patients without being enrolled in the Medicare program? The answer is no. Can you collect cash from Medicare patients without billing Medicare? Is that possible? Yes. Patient goes on wellness and signs the ABN form and checks option 2. Have you revalidated your Medicare organizational profile within the last 3 years? So revalidation is going on right now in many states. So we actually offer that as a service. If you'd like us to help you revalidate, you could probably do it on your own, but we have some practices that they're so busy, they just don't have time. They don't want a staff member to do it, so they outsource it to us to get you revalidated in the PCOS website, and also to get you a new PTAN. Like I had have a client right now that just brought on 3 associates. Really busy practice. He just hired 3 associates. None of them have Medicare numbers. None of them have Medicare PTAN numbers. That stands for Provider Transaction Access Number. And he wants these doctors to see Medicare patients. So we're getting the ball rolling. We're going to get, usually it takes about 3 weeks to get a PTAN number. It doesn't take that long. So can chiropractors opt out of Medicare? The answer is no. Opting out is a private contract. DCs are not on the list of providers that can opt out. Can chiropractors opt out of Hipaa? Maybe. So let me just share with you the difference between Medicare and Hipaa. So the main purpose of Medicare, as I've been reviewing with you right now, is to prevent billing and coding errors. The main purpose of Hipaa is to protect patient health information. So Hipaa applies to covered entities. So you should be asking yourself, are you a covered entity? If you're not a covered entity, you may not have to abide by Hipaa. So are you a covered entity? I'm going to ask you 2 questions, 2 simple questions, and this way you'll be able to figure out if you are a covered entity or not. Question number 1, do you bill or receive payment from insurance companies? If yes, you're a covered entity. If no, then you may not be a covered entity, but you'll have to answer no to both questions. Question number 2, do you submit claims electronically? Yes, you are a covered entity. No, you don't submit claims electronically. You don't accept payment from insurance companies. You might not be a covered entity, and that's the question we get from many doctors. Marty, I'm a cash practice. Do I have to abide by Hipaa? Or, we don't do any billing here in the office. We have a billing company, or everything is in the cloud. I mean, these are the comments that, we hear. Well, most of my practice is personal injury. Do I have to abide by Hipaa and Medicare policies and procedures? Marty, I don't even have a computer. I still use handwritten notes and forms. Do I have to abide by Medicare policy procedures and Hipaa? I don't have any employees, Dr. Kotler. I'm a sole practitioner, small practice. I'm all alone. Do I have to abide by all this compliance stuff? Check with us if you're not sure. We can, have a quick conversation on the phone and narrow down your choices. But, many doctors think that they are Hipaa compliant because they have the patient sign a couple of forms like the Hipaa notice on the first visit, and they're using certified software, and they talk quietly in the office. Does that mean you're Hipaa compliant? No. So back to Medicare. So Medicare wants you to be proactive. They expect you to be proactive. They expect you to know. You don't want to be accused of ignorance, or I call it willful neglect, which means you knew or you should have known that you should be doing this, but you decided that you're not doing it. So here we go. Take action. Read your local Medicare guidelines on chiropractic. You don't see Medicare patients? Read the chiropractic policies from Aetna, Cigna, Blue Cross Blue Shield. Most of the time when I bring on a doctor to work with, and they could be seeing a ton of Blue Cross Blue Shield patients, 99% of the time this doctor and none of the staff members have read the Blue Cross Blue Shield policy on chiropractic. See, you need to know the rules in order to know if you're breaking them or following them. Review these policies with your staff. Log them into your training manual. Get formal with this. It's more important now than ever. Attend seminars, webinars, watch videos, be a sponge when it comes to this. And if you don't want to do it, doctor, because you're so busy and it might seem overwhelming to put another thing on your plate, have somebody do it for you. Have a staff member do it for you. Now you might say, my staff is overwhelmed, their plates are full, then outsource it to a company like us, and we'll do it for you. This is not a big deal, so to speak. In 1 or 2 trainings with us, you're done. This is a very short-term, project creating a policy and procedure manual. With our company, at least, it only takes a couple of visits and you're on your way. So you want to review patient notes with a certified coder? That's nice. So a Medicare policy and procedure manual or any type of billing and coding procedure manual can prevent audits. It'll definitely help you sleep better at night, that's for sure, and it may improve office efficiency. Let me give you an example. I'm working with a doctor right now. She was audited, and she's being accused of upcoding. So her notes show that she did a 98940, but the claims were going in as a 98941. You see, the doctor in the back of the office was doing a 40. There was some miscommunication with the front desk, and the front desk was just billing 98941s. So by having this review, by having this policy and procedure manual, it causes you or makes you check things. And now this doctor has a new system. We've worked on a new system where that will the chances of that happening again, based on what we did, is almost zero. Of course, there's no guarantee, but there's basically no way that will ever happen again based on this new patient flow system that got worked out between the doctor and the front desk. So I think I've made my point. It's pretty important to have a policy and procedure manual. Just a few closing comments. Check with the carriers you bill. Make sure the things you're doing are compliant. We can't guarantee that this information will guarantee payment from insurance companies or patients. It's important to stay on top of the changes, attend seminars, webinars, join your national and state professional associations. Here's our contact information. Before we get to questions and answers, let me just share with you our contact information. Email is info@targetcoding.com. Website is targetcoding.com. Telephone number 1-800-270-7044. And a couple of things. So we offer Medicare policy and procedure manuals. It comes with customizable forms, letters, templates, policies, and procedures. We create it for you. We put it together for you. Of course, you could do it on your own, and you should. But if you don't want to, then go ahead and let us do it for you. We have sample training logs, background checks, employee training forms, articles, links. And again, I mentioned if you say, well, we really don't see that many Medicare patients, or, but we think it's a good idea to have just a general billing and coding policy and procedure compliance manual. We offer that too. Again, you'll get a comprehensive, customizable chiropractic billing and coding compliance manual with billing and coding policies and procedures personalized for your practice, the little chart, review tools, employee training logs, forums, templates. So let us know if you're interested in that. And yes, we also offer Hipaa. This is a whole nother level. Hipaa is very comprehensive. Hipaa takes a few months to get going and incorporate. Again, if you want to go ahead and do it on your own, go ahead. It's pretty overwhelming, but you can try. If you don't want to do that, contact us and we'll help you put together a very comprehensive security risk analysis, which is required, especially if you're going for meaningful use in the new MIPS program. Our security risk analysis meets the measure for advancing care information. And it's a cloud-based storage portal, plus you get everything in hard copy. We have compliance training videos for your entire staff, Hipaa compliance testing with little certificates of completion. The Medicare training manual is part of our Hipaa compliance program, so that's included. And we also have a really good book that we sell. This is our best-selling book. It's called the book on the guidebook on the best chiropractic ICD-10 and CPT codes to improve reimbursement. It shows you how to pair your codes, and it shows you the codes that will pay for the most visits. I call them long-term treatment diagnosis codes. You get these really good cheat sheets, so at a quick glance you could see, hey, what are the long-term codes, short-term codes? We also give you a section, a clinical section. This got added for those of you that have bought my books in the past and you don't have this one. This one has a whole section here on, I got a little clinical with this book. I'm the code geek, I'm the code guru. Yes, am I the clinical geek? No, but I put together a few clinical scenarios. For example, if you're going to, diagnose a patient with cervical brachial syndrome, what orthopedic tests should you have in your exam? What neuro test, chiro test? So I put together, and that's important. You want to be able to justify every diagnosis code. And then there's a really good, I've been gathering questions over the last many years, and these questions will come to me from chiropractors that are in practice. Maybe, they could be in practice 15, 20 years. And they go, Marty, what's the difference between a disc disorder and a disc displacement? What's the difference between effusion, swelling, edema? What's the difference between myalgia, myositis, myofasciitis? What's the difference between cervical brachial syndrome and cervical radiculitis? General questions you may have been thinking about, but now, you have the answers. Other things we do here at Target Coding, we do seminars. We have a whole bunch of seminars coming up, and we do webinars. Many are approved for continuing education credits. And actually, what we can do is if you wanted to have a personalized seminar in your practice for you and just your staff, we now offer that. Plus, we can get you CE credits. Yes, we can have a little private Tupperware party in your office. All you need is internet access, and I will provide, we call it our seminar delivery service. So we will bring the seminar to you online where you can watch it right in your office. Plus, we'll get you CEUs. So that's new. We just started that. And then we also offer membership programs. This is our basic membership. It's $99 a month. You pay as you go. You want to upgrade and get some more personalized training. This is our gold membership where we get we do a real comprehensive review and deep training for you and your staff. After we're done with you and our gold membership, you will be a 10th degree black belt in billing, coding, compliance, and compliant cash plans. Again, here's our contact information. Just want to thank everybody for attending. Let's go ahead and take a look at the questions that have